and CEO here at Prevent Child Abuse America. I'm just so thankful to be on this call with all of you today. As you all likely know, because you helped contribute and create this theory of change over the last several years. And if you're not talking, please mute, because we have about 80 people on, and we just want to make sure that we can get to hearing from our PCA state chapters and Healthy Families America affiliate sites. We're just excited on how they are starting to align and implement the theory of change, put it into action. But some reflection that I have is, it's Black History Month, as I mentioned, February. And, I've been trying to catch up on my podcasts, and I know Nathan and other podcast lovers are on with us today. And just today, I had the opportunity to listen to some of the audio nuggets, right? That's Mining for Gold's series. And I always enjoy that one. But the one I was listening to today, Jasmine Sullivan says that sometimes in our, not Jasmine Sullivan, Jasmine Sankofa. And she says that sometimes we're so focused on freedom from oppressive systems, as opposed to reframing that we want the freedom to. And just that shift, and certainly, and if those of you who don't even know, I think she has the coolest last name, because Sankofa literally means like to retrieve, right? Retrieve from our past. It's generally used to say we have to look to our past to be able to build a successful future. And with that, I come to this conversation thinking about this is what we are dreaming, right? The freedom to that all families and children can live a purposeful and happy life with hope for the future, right? What are all the things that we want our own families to have, our own communities, but that we know that if all of our children and families have them, that we can really transform our lives, our generations, our ability to reach our maximum health and life potential together. And so anyway, I just was really excited to come into the conversation today with all of you, again, who have been joining us and really figuring out what is it that we all need to do? What do we need to stop doing? How do we need to partner? How do we need to continue showing up? So that we can really reach that sort of collective North Star. Our theory of change obviously lays out aspirations for children and families. These are things that we're always working to achieve, right? Loving and secure family relationships, formal and informal supports of every type, financial stability, economic mobility, mental and physical health, well-being, thriving, right? All this good stuff. What do we not see in our theory of change? The words child abuse and neglect, right? So for some of us, it's like a new day, and I'm excited to hear from our state chapters and HFA affiliates and teams on how it is that we're really able to embrace that. It's, again, what we're trying to achieve, not forgetting or not leaning on heavily what we have developed in our past, right? PCA America, 50 years, right? We've been working on this collectively in partnership with all of you inside and outside of our network to really be able to put these aspirations into practice for children and families. It's just really a humbling time to be among you all, to be your friend, your partner, your colleague, and to learn together. Our panel will be officially introduced in a minute from Jen Jones from my team, Chief Strategy Officer for PCA America. But I just want to say I'm just so grateful to all of you for staying with us, right? To being connected together this next year of zooming out. I know we have a lot of cool content and things that help us think together and learn and question and love and nurture all of the things. But today I'm so excited that we're going to get to hear in action about how some of those of you in our network have really helped to really get us started in creating this primary prevention ecosystem in this country, which does not exist. I was talking to partners and funders. I had quite a day already talking to lots of people, but really the energy, right? It's like we are trying to do something that we've talked about for a long time. I mean, not in these 2 years, but in the last generation of this work, the last 20 years of this work or more, are calling to what now we are actually aligning and implementing and creating together. So anyway, I'm going to be quiet now, I think. I hope I said anything you wanted me to say. Jen and Kirsten, thanks for really putting together just such a wonderful panel for today. And I will give the floor to you, Jen, to get us started. Thanks, everyone.
Awesome. Great. Thank you. Thank you so much, Melissa. It's really my honor and privilege to be able to welcome and introduce this truly amazing group of leaders in the prevention field. We are so lucky, incredibly lucky, to have each one of them as innovators, thought partners, colleagues, and I will also say friends. Friends in the Prevent Child Abuse Chapter Network and friends in our Healthy Families America network. So I'm going to take just a brief moment to introduce each of them before we get started with our conversation. And because we have so many with us today, when I say your name, if you just want to wave, that would be great, just so people can see who you are amongst all of the people that have joined us today. So first we have Claire Louge, who's the Executive Director of Prevent Child Abuse Arizona. We have Cliff Simmons, who is the Executive Director of New Hampshire Children's Trust. We also have Nathan Frink, who is the Senior Director of Advancement with New Hampshire Children's Trust. We have Jade Woodard, the Executive Director of Illuminate, Colorado. We have Mark Ownby. Mark has a long title, so bear with me for just a second. He is the Maternal, Infant, and Early Childhood Home Visiting, or MIECHV, Healthy Families America State Consultant with the Division of Child and Family Wellbeing at the North Carolina Department of Health and Human Services. So good to see you, Mark. We have Sharon Hirsch, the President and CEO of Prevent Child Abuse North Carolina. We have Mia Crockett, the CEO of Families Forward Virginia. And finally, certainly last, but definitely not least, we have Nicole Cunningham, the Executive Director of Prevent Child Abuse Oregon. I want to say thank you to all of you on the panel, as well as all of you in the audience for joining us today. We are incredibly excited for the conversation that we're going to have with you all for the next hour and 15 minutes, I think, is about what we have here. So let's get started. Let's jump in. Since we officially launched our Theory of Change at our sold out national conference last year, we had over 1,200 folks participate in our national conference. There's been a lot of buzz and excitement about this new direction for the field. Dr. Merrick mentioned it does not exist. We are working to create it. And so tell us what struck you to instantly say yes, to say, this is it. We need to do this. And so Mia, why don't we start with you if you don't mind?
Sure. Well, thanks for that lovely introduction. It's so good to see a lot of friends on the screen. As you maybe recall, maybe from the conference when we kind of talked about the theory of change there, you know, my team, we were kind of over the whole idea of another strategic plan to do a plan that just sits on the shelf, and then we have to revisit that plan in 2 years to do another plan. We were totally burned out. However, when hearing about the theory of change and really being part of some of that background conversations and kind of really norming and storming around this idea, it became so clear to me that this was a simple answer to this huge question of how do we really think about measuring the impact of prevention across the nation. And the theory of change was such a simple, clear way to do that. It was kind of like for me, I saw it as a blueprint on how to put in the goals and strategies in a place that it made sense, and a place that could be cascaded to not only folks internally in my organization, but to the board, to our community partners. And then how could we then roll that out, you know, in a statewide type of way? And what would be the mechanism of action to do that? And so for me, the theory of change was just such a simple, clear way to do that. It wasn't complicated. It didn't require me to have a PhD in strategic planning. I didn't have to create a whole new galaxy to put the work in. It was kind of all there, and it was easy and accessible, and you could take it right from the website and really start doing some work and adding your own objectives and strategies to the theory of change that I thought was really just exciting and new. And like I said, for me, clear is kind, simple is always better. And so those two checks were checked off, my list of how easy will this be to kind of work on this theory of change in my state. And so it was clear and it's simple and it's accessible. So really it's like three things that kind of hit all my good juju. And I was like, yeah, we're doing it. We're theory of changing it, people. Come aboard. And my team grown, but now they're a little bit more excited about it now because I keep talking about it and they're like, okay, we get it. And I'm like, yes. So that's what kind of made me really excited to dive in.
Awesome. Thank you so much, Mia. Thanks for starting us off. Thank you for your leadership in this space. Let's go next to Nicole Cunningham. How about you, Nicole?
Absolutely. Thanks, Jen. So for me here in Oregon, it was specifically that ecosystem of prevention language and the way that I saw that cross-disciplinary collaboration at the core of this theory of change. I really think this theory of change invites partnership, and it helps us to take those who might consider themselves traditional and those who would consider themselves non-traditional partners in the work of child abuse prevention to be able to see how our different approaches can support each other and actually fit together really nicely. I think I was immediately drawn to this really holistic approach to child and family well-being, and the way that this theory of change centers the whole person and the whole family surrounded by systems and services to support their well-being. I think that's what we need, right? We need an infrastructure that cares for kids and families, meets their needs, creates opportunities to thrive, but it does so without stigma or fear or shame. And so for me here in Oregon, PCAO, Prevent Child Abuse Oregon, we're really working to shift the conversation and the priorities from thinking that downstream reactive approaches are the only way to deal with abuse, right? Instead, we're working to lead with abundance and health promotion and early upstream investments in families, as well as that belief that together we actually will build a well-being infrastructure. And I saw all of that reflected in this theory of change, which is why we dove in.
Thank you so much, Nicole, and thank you as well for all your leadership in this space. I have Cliff and Nate. Obviously, they can't speak together at the same time. So why don't we start with Cliff, and then Nate, let us know really what struck you both as you heard about the theory of change and said, we really need to do this in New Hampshire.
Yeah, we were down in Baltimore with everybody else. And, I'd love to have this epiphany moment, but, we're inherently lazy, or at least I am. And I looked at that and said, oh my gosh, it's all right here. It's right in this nice package. And it was clearly understandable. It made sense. When I came into this, the trust, the New Hampshire Children's Trust, I came in from outside the industry and I heard a lot of language, and we try to apply it with Thriving Families, Safer Children, and we continually to try to apply it. This started to create terminology and concepts and theories around and strategies that are really understandable, really made sense, things that we were already doing that we could put names to. It made a lot of sense to us. And I just liked the idea going into a new strategic planning cycle for us, that we would be able to have this roadmap in front of us that could help guide what we're trying to do. And we really centered on that term ecosystem as a part of what we wanted to bring to New Hampshire and define that in that upstream space. So Nathan, you can fill in.
Definitely. Yeah. And I think this kind of circles around the experience that we both had with the document itself and the way it laid it out. And people have mentioned this too, the simplicity that it laid it out. And I think that when I approach these types of theories, these types of documents, I have to go, I use my academic reader brain, and then I use my lizard brain to see how I'm going to implement something like this, because I exist in my lizard brain all the time, and the truth is that, as a parent and a caregiver, we've got this professional hat, but then this parent hat, and we spend our time really bouncing between these systems. And so the way the document brought us above to look down, I could see my parent self in it. I could see my professional self in it. I could see the partners that I also know that are parents and professionals in it. And much of the work that we do to change social norms is try to place other organizations, people, individuals in this greater narrative that is primary prevention. If you can see yourself as or in that narrative or as part of primary prevention, then you can actually act. And so rising up above it and thinking with all of those different hats we wear, I could see how I fit. I could see how, the organization that we work with around, DHHS, I can see how they fit. Our business partners that are kind of clamoring to even attract younger workforce, I can see how they fit. And so, and then it lays it out, this kind of if this, then that type of a mentality. This is a true roadmap. So that's where we started to get energized about it. And Jen, I will say next time you ask Cliff and I something, ask us to do it in harmony because it's spectacular.
I thought about that, but the rest of the panel would be very jealous. And so I didn't want to make them, I didn't want to make them feel bad.
I go high and Cliff goes low. That's all I can say.
It's awesome. Thank you, Nate and Cliff. I love, Nate, how you just said, I see how I could fit in it. And I think that's kind of a theme that's running through most of the folks that we've heard from already. So thank you both. And thank you both for your leadership. Sharon Hirsch, North Carolina.
Thanks, Jen. I want to say ditto to everything my colleagues have said already. And you all just always reinforce what I've been thinking about. I want to go back to what Melissa said at the beginning, because one of the first things, even as we were looking at early drafts of this before it was finalized in August, the first thing that jumped out at me was that the words child abuse and neglect were not in this theory of change. And we so often we want to talk about what we want to see for kids and families, rather than what we're trying to stop from happening. And I think this just so beautifully talks about what we want to see. And I think families can see themselves in this, instead of assuming that if we're talking about child abuse, that's not about my family. That's not about me. That's about other people in other communities. That's not for us. So it so clearly then comes full circle back to being a public health approach, rather than an intervention programmatic kind of way to tackle this important issue for us as a society. I also think that the fact that this is really grounded in equity was also one of the things that really attracted me to this. We've been having lots of conversations within our organization and with our partners about how do we get to better equitable outcomes for kids and families. And this beautifully does this by focusing on what we want for all families and all children, especially those that are left behind. And so when I go back and look at all of this, I realize this entire theory of change is grounded in our core values as an organization. It is grounded in equity. It is data-driven, and that data includes the data that we're getting from families. It says centrally that partnerships are the key to getting the work done, and that this is a community-wide responsibility, that no one agency, no one organization, no person is responsible for this work by ourselves. And so all of our partners can see themselves in this as well. So that made it so easy to say, yes, I want to be a part of this.
Awesome. Thanks so much, Sharon. And thank you as well for all your leadership. Just a note and a caveat, I did not pay anyone to say anything that they said. And so these are all true, genuine words from the heart. So Mark, you are a great asset from our Healthy Families America site and have been also very involved in this from the beginning. From your perspective, Mark, from Healthy Families America, why do you think this is important, and why did you say yes?
First blush, it was going back to something that Mia talked about, was just the simplicity of it, the way to really help describe a really complex issue in very simple ways that does flip it from being sort of, deficit based to a positive focus. And the sort of intuitive usability of it, from that really large system level, but as you continue to narrow the focus all the way down to individual families that we work with, it's a nice framework. So I see a lot of use at the program level as folks are developing their quality assurance plans and equity plans, which frequently sort of overwhelm folks because they're not sure where to start. This is a really nice framework to sort of do that work inside of, because it sort of guides you with those aspirations in the primary prevention ecosystem, as well as looking at, who is included in advisory committees at the local program level. It sort of can open eyes to look past those sort of traditional partners that we've always had in those kinds of committees. And what are the other collaborative partners that we need to be building relationships with at the local level, to really sort of take advantage again of that primary prevention ecosystem and really leverage those pieces for our families in those communities, and can guide some thoughts about strategies for family recruitment, past sort of what we've traditionally done. So I think it helps us break out of some of those boxes that have just been there, because that's the way we've done things, because we've looked at things a certain way. And then I've also thought about how it can be helpful with families, just some of this conversation around those aspirations for kids and for families, I think could be great jumping off places for conversations with individual families about what their goals are as we go through that process of goal setting with families. And as we think about, at the supervisor or family support worker level, developing service plans for families, just sort of broadening those views again past what we sort of traditionally have looked at, which have been holistic, but there's a broader reach for those things. And the other thing, given my work as part of the state team that manages funding for home visiting, is I see a lot of use as we are developing needs assessments to sort of broaden and deepen that investigation of really what are risk indicators. They might not necessarily be deficits. They may just be that there's not anything going on in a certain area. Some of those types of thoughts. And then as we develop requests for applications for funding opportunities, sort of building some of those pieces of the theory of change into that, particularly looking at folks' ability to really readily implement with fidelity at the local level, and really make some impacts with the services they're delivering.
Great. Thank you so much, Mark. And thanks for being here. Jade from Colorado.
Hello, everyone. So this theory of change came at a really interesting time for Colorado. We were on the cusp of strategic planning, similar to how Mia shared earlier. And what we were identifying was that we have, the mission and the vision, the long-term, what do we want to be when we grow up? What did we want to accomplish? And then we have these like year-over-year annual goals and KPIs, and this is what we're doing this year. And we, in our strategic planning process, the thing we identified is that we were missing what connected the two. We were missing what are we doing every single day? Like how does our day-to-day action connect to what we're trying to achieve on the big picture? And this theory of change was like, oh, well, that's it. That is the thing that connects what we do every day and why to what we're hoping to accomplish as an organization. I do have a couple of slides, and every time I share slides in a situation like this where no one else shares slides, I hear Trevor Stores in my head from Alaska saying, there's Jade with her pretty slides again, showing everybody up. It's not that, I promise. I really just don't have a whiteboard anymore, so I need to write things down in a visual way. So I was just going to show a couple of slides because the thing that made the biggest difference for me truly was the plug and play. And I remember Jen saying, like, it's really that simple, Jade. It's just a plug and play. You just download it. And so I got a wild hair one day and was like, all right, well, let's plug and play for Colorado. And so I took off the PCA website, their version, and I put in Colorado's branding, our branding colors, and I put in our strategies. So you'll see here at the bottom, we organize all of our work based on the spectrum of prevention. We've adapted it a little bit, but the spectrum of prevention is through the Prevention Institute. Says essentially, if you do these 5 or 6 things at the same time, you'll have a greater impact than if you're just working at any one of these levels. And they just beautifully mapped onto the theory of change. And so I started here and I was like, oh, this is making sense. This is working. But how do they actually like connect? How does what we do today connect to what we want to do? And how does it connect to the ecosystem? So then I started drawing some lines, and then it was like Spider-Man went crazy on my slide. And so then I've started kind of looking at it in multiple different ways of, you know, what is the direct link? Where is this a little bit more distal? Where do we want to be more intentional in trying to achieve this ecosystem? I've gotten to the point where I've started mapping it out. What's our kind of strategy? How does that connect to the outcomes we're looking for and our short-term priorities? How do those line up with PCAAs and their strategies? I could go through this for days because I have been kind of obsessed, because for me, it has really just been about the fact that, you know, what we're doing every day here, we know is important. We know it's for a reason, but the theory of change has allowed us to show not just how we're contributing nationally, because I can map it nationally, but it has helped us to better be able to describe why we work the way that we do, why we have these approaches that are, you know, across multiple different strategies, how we're working towards a bigger outcome altogether. And to have this plug and play and just be able to pop it all in and show it visually has really helped to bring, you know, staff along and really helped to communicate how we are part of something bigger.
Awesome. Great, Jade. Thank you so much. And the slides were beautiful. So thank you for showing those. And finally, certainly last but certainly not least, right? Our good friend Claire in Arizona. Claire, how about for you? What made you instantly say yes?
Gosh, well, what can I share that has not already been brilliantly shared by my brilliant colleagues? So I'll say that when I started off with Prevent Child Abuse Arizona 10 years ago, I used to ask people, like audiences that I would present to, how do you prevent child abuse and neglect? And oftentimes the answer I'd get is, well, you look for the signs of child abuse and neglect, and then you call and you refer that family to CPS or to DCS. And we know that that's not prevention, that's intervention, but that really is the collective mindset that we are stemming from, or really it defines the work that we need to do in order to shift mindsets. So a few years later, I would ask the same question, hey, how do you prevent child abuse and neglect? And people started to say something a little bit different. They said, well, you educate. And I'd say, well, you educate who? And they'd say, well, you educate the parents, because if they knew better, then they would do better, which we know is a piece of prevention, but it's not the whole picture. Recently, and I think this is because of Melissa's leadership and because we're kind of beating the same drum here, and this is so wonderful, I've been getting answers that reflect more of the answer that it is about the conditions that families are within, that it is about parenting education. It's also about social connection. It's also about concrete support. It's also about really the systems that support families. So really, prevention of child abuse and neglect is family support. But when we think about it that way, that it's about housing, it's about behavioral health, it's about social justice, it's about equity, it's about racial equity, it's about everything. It becomes about everything. And how do we tackle everything? Therein lies the challenge that we all have, basically. What I love about this theory of change is that it does several things. One, it is a unifying force, a source to really get it on paper in a way that is understandable and visual. Love that, because prevention is everything. And so how do you capture everything? Another thing that it helped me understand is that talking about prevention and shifting mindsets, and that's actually written in there, that shifting mindsets, that is our work. So sometimes I've thought of like programs and trainings as that's part of Prevent Child Abuse Arizona's work. And then there's the development and the communications team, and they talk about what we do. but the development and the communications team are actually doing the work as well by communicating what prevention is, because shifting mindsets is our work. So that helped me just flip the script in my own head about how I organize my team and how I interconnect their work. It also confirmed that our role as a chapter, and I don't know about you, if you see yourself this way, we are an influencing organization. Like the thing that we are supposed to be doing, among other things, is to influence the way that people think, to build partners, and to influence the way that they're thinking. Everything that we do has to do with orienting people to see themselves in the work of prevention. And you've heard this before from the speakers before me. This helps people see themselves as part of prevention versus just us, or just Healthy Families and Us, or just even family support organizations that work directly with families. It really is helping people see themselves in the work of prevention, because prevention is everything. And obviously we can't do everything alone. And we don't. Prevention happens in partnership, Melissa. I love repeating what Melissa says because it makes me feel smart. A few other things. So concretely, and by the way, like, we haven't really implemented this in any formal way, but just the shift of language and visuals has helped us. One of the things that it's concretely done is it has led to the decision of both the board and I to let go of certain projects that have historically been conducted by Prevent Child Abuse Arizona, but are not in line with what we mean. And specifically, those are projects having to do with intervention and investigation. And those are not bad projects. They're extraordinary. They're amazing. Like we had a project having to do with training law enforcement how to forensically interview children. And again, that's an important training, but it's not who we are. Who we are is, again, helping people see themselves in prevention, and that prevention is family support. Prevention is reducing the overwhelm on families. And so we are consciously letting go of things that are not in line with our big vision. And so this really helped me figure out that that's the right thing to do, even though it's hard. And lastly, it can be a guide of guides. I don't know about you, but I'm in, straight up, not without exaggeration, 20 different collaboratives that have to do with child well-being, collective impacts and focus groups on this, or we have different things that happen all the time when we want to be involved, and that's how we build partners and influence. But damn, like everyone's trying to do the same thing in different ways. Wouldn't it be awesome if there was one unifying roadmap to tie all of our efforts together? That's how I'm hoping to use this thing and to continue working together, helping people see themselves in prevention and shifting mindsets.
Awesome. Thank you so much, Claire. I love so many things that you said. I love so many things that all of you said. I'd love to continue to go on off of many of the angles that you talked about, but we are limited in time. We could be here for hours, I think, with all of the great things that you shared. But we're gonna go on to the next question that we're really interested in hearing more from you on, and that is, some of you have already talked a little bit about this. Claire, I think you eloquently talked about this in your remarks. But how do you see the theory of change as different, or maybe more innovative than other work that you've been involved in? And how do you see this strengthening and or advancing the field, the prevention field? So Nicole, how about we start with you here, if you don't mind?
I do not mind. Thank you for that. So you're going to hear me talk about collaboration almost every time I get to talk today. It's just the most important thing to me. I think this theory of change is different and innovative because of that intentional way that it invites collaboration across disciplines specifically. I think in utilizing the co-design process that PCAA used and invited in hundreds of voices, I think this theory of change, right? You've been able to create a tool that amplifies our network's ability to be change makers in this work without ego and without indication that there's only one way to be able to accomplish these goals, right? As so many of our colleagues have said before, right? It's not about any one of us alone, and it's definitely not about any one specific approach to child abuse prevention. It's about what we can do together. And so for us at Prevent Child Abuse Oregon, that's the most important part of what this theory of change offers. It's going to help us advance our work in Oregon because it gives us a tool that will help actually align the goals and strategies to help create that unified approach and narrative around prevention while still holding space for and really honoring those unique perspectives and approaches and strategies that our partners and families bring to the table. I would say this framework highlights clear-cut, research-backed avenues for us to work together and to build on the resources that we have and to connect the dots across the different disciplines that we know are often so siloed when it comes to this landscape of prevention. And so that's what I think is different about this, right? And I'll use the same word that I heard Cliff and Nathan use earlier. This really helps to create a roadmap for our collaborative work. That's just my perspective on what we are doing in Oregon, but I really can only imagine, right, how incredible this will be if we as a network and we as a movement are able to really take this tool and allow it to help create a unified approach to child and family well-being across the U.S.
Great. Thanks so much, Nicole. Sharon, how about from your perspective in North Carolina? How do you see this as being different from the work that you've been involved in this work for a while? How do you see it as different or maybe more innovative and really taking advantage of this in strengthening the field or advancing our work?
I think often when we approach any new work, we're usually talking about programs. And this is not about any specific program. This is about bringing folks together across sectors. And I think that's really, really different. And I think that I just really want to reiterate what Nicole just said. I mean, this is our opportunity to be creating a movement and doing some things consistently across our network where we're all talking about the same kinds of things and learning from each other and then iterating and learning and sharing and using what each other learns along the way. There's so much power in us being able to do that and share the same messaging, to talk about the same things that are working, to help us talk with our partners at the state that maybe aren't as focused on prevention as we want them to be. When I think about this theory of change and how it can advance our work, so often we're asked to come to the table sometimes as an afterthought. Oh yeah, we can't forget about prevention. We're talking about reforming the child welfare system, so we probably ought to invite PCA North Carolina to come. Well, this gives us an opportunity to be the convener instead of being the afterthought, and to help that system itself think about the fact that they haven't been investing where they need to, and to help them understand what the science says works. We're in this, I know that North Carolina is not alone in this, but our child welfare system is so stressed. There is so much turnover. Kids are sleeping in DSS offices every single night. They're sleeping in hotel rooms. And the answers tend to be, we need a larger board rate for foster parents, instead of talking about how do we stop this from happening in the first place. And it gives us such a simple, straightforward way to talk about how this is a community responsibility and how we need to bring other non-traditional partners to the table to talk about this as we learn about it together as a network. The other thing that I think is really important for advancing the field is that it's helping others that are in sectors that are close to us, but not quite us, see their role in preventing child maltreatment. I've had a couple conversations with partners in public housing. And they're like, they look at this, and when I show it to them, they're like, that's our work. When I talk to our early childhood education folks, they said the same thing. This is our work. And I always say it's all of our work, and it helps everybody see that. And so I think it's going to give us all an opportunity to elevate the prevention voice without saying prevention directly, and really talk about that family support ecosystem and how everybody has a role to play. I just think there's just so much potential there, but particularly to put prevention at the front instead of the afterthought.
Sharon, I think too, like Claire earlier was saying, you know, it's really, it's the language, right? The language in this has really helped us, even if, and Claire said, even if we haven't really done any implementation, which I would argue you have, Claire, because you're, even the thought of like not doing things because it doesn't align is certainly one of the first steps. But I think what I heard from Nicole and from Sharon is that this idea that it's giving us a way to be unified, to have a unified voice. I love, Sharon, your comment about being a convener instead of an afterthought. So it allows us to sort of be the national and the mediators of change in our communities. And this whole idea around shifting the mindset. So I heard that a lot, you know, in the time we've been together, this idea around just even the language, the shift in the way we're talking about this has really, from, you know, child abuse and neglect, which we don't even see on the theory of change, to, you know, how we're being, you know, ensuring that all kids and families are living a purposeful and happy life with hope for the future, right? So anyone else, thank you both, Nicole and Sharon, anyone else from the panel want to share how this is different for them, how they see it as being different?
I'd like to pipe in. Just when I was thinking about what everyone has been talking about and the ability to see yourself in the work and the language of this ecosystem, which means it's a growing organism of work, right? It's an active body of work. And so when I think about the arc of family supports, right, across a family's lifespan, all the things that are required for a family to thrive, not just survive, for a family to be rooted in their communities. What does prevention look like? And when you think about like this idea of the North Star, there's many paths to that North Star. It's not just one straight way in. There's many paths to prevention. And I think that's what's been kind of innovative about this idea of this theory of change, is that it says that it's going to be iterative. It talks about this action of this idea of movement. We're heading towards this North Star. We're looking to move forward. That's a path, and anyone can join, right? There's no one way to do it. And so it's kind of like choose your own adventure. And so I just think it's an innovative approach to think about prevention in this active, organic way, this iterative way that we can keep refining and defining the work as we learn more, as more folks join the conversations, as we think about more people adding into the, you know, sitting at the table. That's going to create a different set of learning, another way of thinking about things, another approach. And so I think that's what makes it innovative as far as how we're thinking about prevention and how that relates to the 21st century family.
I love that, Mia. I love the choose your own adventure. And, you know, certainly the whole sort of idea and intentionality around this theory of change was its adaptive nature, why the adaptive strategy process that we use. When we know better, we do better, right? That saying. And so it allows us the ability to iterate, to be flexible, to be nimble, to be adaptable to our ever-changing world. And so I love, Mia, the comments that you shared around how that's innovative, allowing us to really learn and grow and do better and take the knowledge and the information in real time, in changing in real time. So thank you. I really love those comments. Anyone else from the panel want to comment on that or share? So the next one, I know some of you have already said a few things in regards to this next question, but really interested in hearing about how or why you have incorporated the theory of change into your work and into your efforts. And Jade, we're going to start with you, and you have shared some of that already. Anything else that you want to expand upon in terms of the how and the why?
Yes. So one more slide. I brought my thinking to Jen and Kirsten back in December and kind of said, kind of help me make sure this makes sense. And one of the things that Jen shared with me was thinking about how budget plays into this. And that really got me thinking, because that is, that is my role, is really around how am I securing and directing resources. Illuminate has grown really quickly. For those of you that aren't familiar, we've gone from 5 staff to over 50 staff in less than 5 years. It has been intense. And I guess in less than, it's 7 years. It's been intense, long story short. And so one of the things that is really clear about where I as an ED can influence is our budget and how we choose to spend our money and how we choose to invest it. So I took Jen's suggestion and I mapped how does our budget show up across the primary prevention ecosystem. And this is not going to surprise anybody in this room, but we've got about an $8 million budget, and 5 of that is going into direct service. So these are our, Circle of Parents, our childcare program, a navigation program, Healthy Families America, another home visiting program, Family Connects, and we just recently took over the Safe Babies and Safe Babies Court Team program. But you'll see here, we are heavily investing in family supports and opportunities and environments. And not that that's necessarily bad, that is work that maybe costs more. It is more people intensive. It is more where we're going to see those direct impacts on a day-to-day basis. But you'll see as we kind of go down, like it kind of gets a little sad when you look at like policies and practices and decision-making and formal goals. Like I couldn't even figure out how to put a budget number to that, because it really is integrated into everything else that we do. Like those should be outcomes, but clearly we are not directing exact work towards those levers. And so I think there's been a really kind of aha moment for at least our leadership organizationally that is, all right, we kind of have those top 3, but we've got a lot of thinking and prioritizing to do around those kind of bottom 4. And again, I think the thing that Jen shared with me that was also just huge is this reminder that, to the left here is where we see the larger impacts. So if we're investing so much of our resources on the right side of this theory of change, we are still in the kind of day-to-day shift. We aren't yet putting as much as we'd like to in the like high value systemic change that we want to see in our state. And so I think that's been just a lot of the ways that we've been incorporating this into our day-to-day, and a lot of the ways that we've been shifting our thinking is this stuff on the right is important. I don't want to stop doing that. I don't want to close any of our programs, and we're feeling really solid about the work we're doing over there. It's more, how are we intentional about what's on the left? How are we investing about these kind of pieces on the left here? How are we making sure that they are as strong, if not stronger, than our direct service work? Because it will just make the work that we do directly with families more impactful. So that's kind of my high level, I think, how we've been incorporating this in our day-to-day work so far.
Thank you, Jade. That was a beautiful example, and I think really helpful to see sort of what are some ways that we can take this theory of change and incorporate it into our work. I think that was a really great example. Thank you. Sharon, how about from your perspective?
Well, first, it's just not fair to follow that. That was brilliant, Jade. But so helpful for all of us. I mean, that's what I love about being a part of this network, is that now I'm going to go back and do the same thing and figure that out. So that's just amazing. But how we've started to think about this in North Carolina at PCANC is on our strategic plan. We're getting ready to launch our strategic planning process. So I'm listening to what everybody else has said about how they've started to do this. And our board in December adopted the aspirations for children and families as the big outcome goals for our next strategic plan, and have given us the authority for our staff to figure out, so how do we get there? What are the strategies? what do we need to be doing differently? And we'll be having those conversations over the next year. And we're thinking about how do we potentially even use the Zooming Out series to help our staff and our board get engaged and thinking outside the box and not spending all of our time and effort on that right-hand side of the theory of change, as Jade talked about. Because when our VP Crystal Kelly and I talked to Jen and to Kirsten about this, we had the same conversation about how the bigger levers are on the left-hand side. It's about changing mindsets, setting those formal goals. So that'll be a big part of our work moving forward. We haven't done a lot. And I also want to mention that we're in the process of rebranding. And like this theory of change not having the words child abuse and prevent in it, we will not have those words in our name moving forward. I can't tell you what that is right this minute, but in the next month, stay tuned. But it's very much aligned with what this theory of change talks about. And so our messaging is really, as we're rebranding, we're using this messaging much more, and we'll continue to refine that. And we even had a conversation about it this afternoon with our entire leadership team about the rebrand and how we get the message out and how we're going to continue to have that be a very iterative process, that the document we have today with our core messaging is going to change as we get better at this, but we'll keep working on it together. So there's just so much opportunity here to use different language. And I think that rebranding piece, I hope, is going to help us focus more on that left-hand side where we're talking about changing mindsets, because we're going to be talking about what we want to see for kids and families instead of what we're trying to stop from happening. And that's such a huge part of the work.
Great, thank you so much, Sharon. And obviously, thank you for all of your leadership in this space. I think what the work that you all do, Jade as well, and all of you here, certainly we learn from at the national level, and certainly guides us as well. I think all of us. So thank you for all your great work. Nicole, how about you? You want to share a little bit more about what you're doing there?
I do, yes, thank you. And I think this is such a cool forum as well, because it's really interesting to get to think about how this theory of change is being used with different sizes of chapters, right? You've got someone like Illuminate, right, where they've got this $8 billion budget, and then you've got someone like PCAO, which is Oregon, and we have a budget right now that's less than $500,000. And so it's really incredible to look at the way that these different levels of bandwidth and capacity are actually, supported and strengthened by this tool. So I just wanted to call that out for anyone who's sitting here wondering, like, does this apply to my chapter or to the work that I do based on the size of our organization? So at Prevent Child Abuse Oregon, we really took this framework and ran with it early on. We were lucky to get exposed to it, pretty far, a hot minute ago is what I'm trying to say. And so we've been in a period of capacity building as a small chapter. And I was really lucky that we had the timing of this theory of change align with whole rebrand as well, and this really rich period of strategic development, much like our other colleagues have noted. But we've been using this theory of change to help align all of our current strategies and our future visioning around the work that we're going to take on next. And so what this has done is it's really given us the context to be able to look at how our work is already supporting the research-backed levers that PCAA has identified in this theory of change, as well as those opportunities, right, where we can really expand and grow our work to impact levers where we don't have a lot of emphasis right now. We're actually utilizing the ecosystem of prevention concept as our umbrella concept now. This is what we are orienting all of our strategies towards. And so we're looking all the time now at how is our work either getting us closer to or further away from this comprehensive aligned ecosystem of prevention. I'll just say that this theory of change has been a really beautiful complement to our policy framework, and using both of those together, right? Using what we already had, the tools that we'd already created, and then this new language, this new framework, all of that has been incredible to be able to create this touch point that we can always come back to ensure that we are being intentional about our approach in Oregon and in the broader push for prevention as we're kind of fitting into this landscape within the US context. That's all I'll add right now.
Just that, that's all. Thank you. Thank you so much, Nicole. Anyone else from the panel want to reflect on or share any of the things that you all are doing to incorporate the theory of change into your work?
I did actually remember one thing that I forgot to say. If you don't mind, can I add just one more?
No, go for it. Of course, of course.
So we're looking at this, right, for our strategy and for our alignment with the national pieces, but we're also going to be taking a foray into using this with our Child Abuse Prevention Collaborative that brings together 21 different statewide organizations in Oregon. And I just wanted to name that, right, that it's helpful for alignment for us and for alignment with the national network. We're also going to be using it very intentionally with our partners to really look at how we can align our strategies and our priorities just in that collaborative space. And so we'll be really excited to get to share back around the different ways that we can use this as we're diving into those different avenues.
Nicole, that was beautiful transition to the next question, which is, how are you leveraging funding and partnerships around the theory of change work? And I think we'll start with Cliff this time. Cliff?
Yeah, this theory of change actually creates a huge opportunity to go to funders and to talk with them about some of the components and the pieces of it, but also what the impact of the whole is. And so that's how we're kind of approaching it. New Hampshire's really hungry for transformation of the child well-being system and moving it upstream as possible. And we've been able to grow our position in the state quite a bit over the last 3 or 4 years. I think we're somewhere around 2,000% revenue growth over the last 3 years or so, which put us in a really good position to go to funders and say that we have the strength of network and collaboration among others to bring some of these funding resources into New Hampshire or throughout New Hampshire so that we can really build this concept of ecosystem. It's really playing out very, very well with funders because there's so many components within that if they want to be very specific to what they want to fund or to broaden it out. So we've done, we do a lot of strategy building summary documents to give to funders and say, start with, well, why don't you throw it at the whole picture? But if you really feel more comfortable in some of the specifics of it, we have this sort of cadence to what we want to do and how we want to do it and a timeline around that and how we're overlaying some of our communications and other pieces into it. So we're giving a lot of opportunities, a lot of broad opportunities within this theory of change in order for funders to participate. And they really do want to participate. They love the packaging. It makes it, again, going back to my inherently lazy comment, it just makes it so much easier to show that document or show pieces of it and some of the graphs and utilize that. It's tangible, it's concrete, and a lot of what we do isn't that tangible and concrete. So when we say prevention, it gets in the vapor world a little bit. We all know that, and we're always trying to bring it home. This does that. It makes it very clear and simple about where those investments are going to go and how those investments are going to impact as they move forward. So that's how we're going about it, and we're getting really good success right now. We have a lot of commitments to put into this, into the work that we're doing, and we're looking at it from our internal strategic planning and our external. Right. So this gives us this opportunity to do both. So we are fundraising on both sides. We have an internal set of strategies, goals, activities, components that we need to accomplish. Right. But they have to go alongside of these external pieces that the theory of change does. And so that's how we're building that kind of that dual opportunity for funders to both affect change with our statewide child well-being system, but also affect change and impact within the Children's Trust and the work that we are doing with the network of family serving organizations, which we're very heavy into the Family Resource Center network. That's kind of how we've really built our strength amongst the state. So it's a great opportunity. It's an easy opportunity. It's honestly an easy sell to funders in my estimation about how you can get them involved and get them to understand it. It also brings in a really great multi-year component which we're very heavily on selling to funders, because one and done is very difficult, as we all know. We're very heavily state and federal funded with the money that we have, which doesn't really show for sustainability. So we are asking our funders to participate in the sustainability of this program, right from getting it started in a 3 to 5 year time frame through to that implementation, with points in time in that 3 or 5 year time span to go back to them and say, hey, what you gave us, what the investment you made was really fruitful. You need to come back and make a further investment in some of the implementation phase of what we're doing.
That's great. That's great. Thanks so much, Cliff. Nate, was there anything else you wanted to add from the New Hampshire perspective?
Well, you know, on the follow-up question too is how the staff. So, you know, I'm willing to wait for that one, but I think
Okay.
Cliff has done a wonderful job.
Beautiful. Thank you, Nate. Nicole, was there anything else? You had started to say this in the last question. Anything else that that you want to share in terms of how you're leveraging funding and partnerships in your state?
Yes, absolutely. So I think a lot of what I have to say really resonates based on what Cliff was just saying. So thanks for that, Cliff. I'm glad to be able to follow you in this conversation. So we've really found that the theory of change is giving us a really helpful tool to, like Cliff was saying, paint that picture of what research is saying about abuse prevention and child and family well-being. That's been really helpful for us in developing grant requests and other resource development avenues, as it's so much easier to put to words the work that we're doing and show how research is actually supporting that work. We're using this ecosystem concept to help guide our approach, and we're getting clearer, right, and stronger every day in how we're talking about that bigger picture. And what I think is important about that is that the bigger picture has been helpful in getting funders to see the potential of their support. And those very specific strategies are those bite-sized pieces that funders are used to when it comes to funding things like a project or a program. And so without both, what we experience is that strategies might not paint the full picture, and the bigger picture by itself might be too much to understand in terms of tangible implementation when you don't break it down into those more bite-sized pieces, right? So we're having a really similar experience using this tool, especially with the development of partnerships and new relationships in the private sector and with business partners, which is a new avenue for us that we've really dove in this last year to those relationships. And what we're finding is that because those partners are not steeped in this work every day, right? They're not foundation folks. They're not, government folks. They don't know all of the ins and outs of what child and family well-being or abuse prevention look like, right? So we're finding that having those bite-sized pieces is really helpful, but we're also finding that they appreciate that bigger picture, right? They're loving the ability to see themselves and actually see their role in what this work looks like. So I will just say that, we're finding, at least in Oregon, that there's a lot of work happening here. There's a lot of investment coming in from different places, which is incredible. But we're also finding, right, that people are really hungry and really, really eager to have some additional context around how those different pieces connect. That's the thing that's missing, right? It's how does it all come together to make sure that not only is it, a sound investment, not only are we headed in the right direction, but to make sure that we're not duplicating efforts. This is something that we hear all the time, that it's the same thing. You get a pot of money, you dump it into a community, and then you walk away, and then we do the same thing 5 years later, 10 years later, whatever it is. With this, it gives us the ability to actually look at how those different pieces are fitting together. And that context is really resonating for funders as we're approaching them and as we're building out those relationships.
That's great. And maybe in another context, we can expand a little bit about on that, because I think Claire alluded to that earlier, which is there's all of this stuff going on, right? There's all these meetings I'm part of, all these frameworks I'm part of, and really how is this aligned with other initiatives, and how can it be that unifying force?
Jen,
Claire,
may I just piggyback on that?
Of course, please.
Something that has been mentioned before that I just want to iterate is how hungry we are across the nation for a different system other than the child protection system, and how this theory of change is so timely in harnessing that momentum. I like to joke that the opportunity at our legislature is that everyone hates DCS, and I mean that's partially funny, but also it is true that everyone is craving reform regardless of where they sit on the political spectrum. And so to have a guiding star or a framework to move forward, to build that ecosystem or support system or whatever we want to call it. But again, the prevention ecosystem, it just sounds so sexy. This is a really good time to introduce this to anyone who cares about that concept.
I love that. I love that. Thanks, Claire. Anyone else on the panel want to share around funding or partnerships, how you're leveraging those in your theory of change work? All right. So we also want to hear from you around how are you engaging, and some of you have already mentioned this. Sharon in particular told us that her board unanimously approved the aspirational outcomes from the theory of change. We know that Jill, I don't know if Jill from Kentucky is on here, but her board also unanimously approved the entire theory of change in terms of the direction that their work is going in. So curious, how are others engaging, how you're engaging your board, your staff, your partners around the theory of change work, and maybe if there are ways that might be different than how you've engaged with them in the past, you can share that as well. And so Nate, I'm gonna toss this to you.
Yes, thank you. And if your staff, I'm going to start with the staff level, because really this is, kind of the implementors of this kind of mindset shift are right there. And if your staff is like ours, they're very passionate and they're kind of entrenched in this work. And I think that we as an organization, like, you're all saying, we are hungering for this change on the systems level. But I think on the micro level, I've noticed that staff are not hungering to change the way we do things sometimes. And so what we had to do, and I do think that comes from the place of impassioned kind of work. So what we had to do when we kind of came across this aha moment was our leadership team huddled to say, okay, we're really excited about this. We see how this plays and we see it from above because we kind of live in that cloud level anyway, looking down, as Jade was talking about budgets and things like that. But if what Mia is saying is true, that this is adaptable and flexible and kind of a choose your own adventure, and the same with what Sharon has said, this is our work. This is really our work. We have to allow an environment that the staff can see those things and arrive at them themselves, rather than us just coming in and saying, look how cool, this is where we're going. We have to say, here's a pathway, what do we think? And so we got together and had a staggered approach over the course of many months with our staff, especially because we knew we needed authentic buy-in, and we first needed to place ourselves as individuals and an organization going toward whatever we thought was a North Star. So we had to create the environment. So what we did was we developed a series of workshops internally at the ground level in our conference room where, we distributed the document and said, please read this, we will talk about it. When we didn't give it weeks and weeks before, we gave it maybe, a few days before we're going to gather, got into the conference room and gave them a quick history of the document they read, where it came from, where it was introduced, how we, as leaders of the organization, felt about it, when, where, how, why, so they could kind of be there with us. And then we immediately went into, we're about to talk about this with ground rules, and we're going to talk about it in a structured way. And the first thing we did, so not to be talkers and talk at people, was to zero in on this idea of ecosystem, right? We paired off and asked our staff to grab the person next to them, and for 2 to 5 minutes, when I say ecosystem, what do you think about? Anything goes, right? And people were laughing and joking. People started telling stories about camp when they had to do these great string exercises where everything was interwoven and somebody dropped it. And if you felt the drop, you had to drop too. We started hearing about different types of ecosystem, from the healthcare system to environments and, environmentalism through. So that gave us a chance to really interface with what we thought about ecosystem as a concept and how it landed us as individuals. And then we kind of shared that out to be on the same page and really hear how the other staff, all the way through programming to administrative to bookkeeper, how it works for them, how it feels to them. And then we started into a more formalized breakout group where we had chart paper everywhere. And the brief was really simple. We were going to put on the charts, we put those aspirations that are listed out. Loving and secure family relationships supported by foundational skills was one. Financial stability and economic mobility was another. The access to formal and informal family supports. And then the mental and physical health and well-being across the lifespan. Put those up, and we had a very simple brief in groups, small groups, maybe 3 or 4. We asked them, and this is the aspirations, we asked them, do these make sense to us in any capacity? Do they make sense when you hear them, didn't think about them? Do we do them already, or could we see ourselves doing them, and in what way? And we mapped it out. Everything that we did currently, and this is kind of like what Jade was talking about, but more on an experiential level where the people were enunciating it. And then we went around the room and shared those out. And the preponderance of the kind of answers are, yes, in fact, either we are doing them or we would certainly love to do them. So we had that discussion point going, we took a break, kind of decompressed, and then we came back for a second breakout session where we did something very similar, but with the strategies, listed the strategies out and had that very similar brief. And those strategies, we didn't choose all of them because we had to make sure that we had to kind of cherry pick our size of groups, but transforming the narrative around prevention, the build and leverage evidence and influence to influence and advocate for effective policies, grow and sustain human financial capacity, etc. Similar brief. Does this make sense for who we are as an organization? Do we do them already, or can we see ourselves doing them? And again, they went absolutely crazy on listing out these things. And we shared them out. And it turned out that in that kind of very organic way, we could see we were asking ourselves to interface with it, explore it, and try it on for size. And, you know, many of the cases where we had kind of harder mindsets to change internally, they found out that they were wearing the thing already. So it was a very easy sell. And then after that, what we wound up doing was we had to have a similar kind of, I don't want to call it an intervention because we're all about prevention, but we had to have a similar interface with our board. How are we going to invite them into this conversation in a very practical way? And at the end of each of these different kind of work groups, thought processes, we would adjourn with next steps, what they could expect, reports out, and things like that to continuously advance the ball toward, I think, group investment. Because once we saw and had to wrestle with some of the more challenging things, and to put a fine point on that, some of those challenges were, well, look, when I think ecosystem, we are life science. We are life science, and we are going to be running into language life science problem where we're going to have to redefine things. We're already trying to define prevention. Does that make sense? Well, you can do anything you want if you acknowledge its existence. So those things were really great to have come up, or the fact of to change an ecosystem. So an ecosystem is only as healthy as its ability to sustain the life in it, right? And what we know is that a healthy ecosystem is defined as having life that is diverse, many, and stable, and that ecosystem can withstand shocks repeatedly. That's a healthy ecosystem. That's a resilient ecosystem, right? But if we start at the edge and say, help us build an ecosystem, I think Becky Burke, our director of impact, said, impassionedly said, can we talk about whether or not we value families in the first place? Because why the heck are we going to support an ecosystem if the thing in the middle we don't care about? And that was an aha moment, because it's like, oh my gosh, from a mindset shift, where do we start? Mia's right, you can start anywhere, but where do we start in this scenario? So we then had to start to think about the way we talk about this thing. do we need to start with ecosystem, or do we start with families and why they're so critical? And then you arrive at ecosystem as the natural solution for this problem, this supportive system. So all of this work then allowed us to really kind of wash up on the shore of that and say, yes, not only is this us definitively, but we've just identified potential obstacles to uptake or investment in the community, and it allowed us to build forward through it. So that was one, again, this was a series, and this took us to think very deeply about who we were as a staff and our own mindsets, and then to really develop those nurturing environments for us in order to really embrace this thing.
Thank you, Nate. That was what I was seeing some of that in the chat as well. Just a great example and very clear and in terms of how you were engaging your staff in particular and board. So thank you for sharing that. Sharon, anything you want to add from North Carolina? You mentioned a couple things about your board. Anything else that you would add from North Carolina in terms of how you're engaging board, staff, and partners in your theory of change work?
You know, I've just learned so much from Nate. Then I'm going to steal and bring back to North Carolina, and I'll be calling him very soon. But I would say the little things that we've done so far, you know, we've had our staff, we shared the theory of change with our staff when we came back in August, because our entire leadership team was at the conference in Baltimore. We've been bringing it up and having conversations consistently in small chunks at every single staff meeting. And as we engage with our partners, I've started to share the visuals that are at the PCA America website. I put the link to the theory of change there, ask our partners to think about it. And it's just sparking more conversation. And I just love the concrete ways, Nate, that you talked about how we can really engage, particularly staff and board members, because moving the work, as we've all said, from a real focus on family supports, where a lot of the programmatic work has been, to changing mindsets, is about managing change. And you outlined a really helpful process for it. So thank you.
Thank you. Thank you so much. If folks have questions for anyone on the panel, please either put them in the chat, or happy to take you vocally if you want to come off mute and ask a question. While we wait for folks to do that, or maybe folks, you know, need a moment to think about a question, I'm gonna ask another question of our panelists. So please feel free to throw those in the chat, or raise your hand, or just come off mute. So I'm gonna go to Mark here. Mark, as our Healthy Families America key person in this panel. Mark, would love to hear from you, and obviously others. Are there any barriers that you see to implementing the theory of change? And how have you worked to overcome those barriers? And in particular, you know, I think you have a unique perspective from the Healthy Families side. So share what barriers you might be experiencing and how you're overcoming those.
Yeah, well, I should first just say I'll shut up and let's just replay Nate's comments again, because it's that approach. I think the first thing to really think about is there can be barriers. For a lot of us in the field, we just automatically like, oh yeah, this is where our hearts and our minds are, and we just latch onto this. But recognizing that there can be barriers to other folks sort of getting on board, understanding it, or even wanting to understand it from the start, is a good place to come from, so that doesn't take us by surprise. And as I've thought about it, you know, I think two of the potential barriers are sort of attitudinal, and one is baked into the theory of change itself. The good news is the theory of change itself is the way to get past the barriers, like Nate so eloquently described that process. the first is just, it is so comprehensive. It is everything. But has been mentioned so many times, it really does allow folks to find their place in the ecosystem. And I think that helps overcome that barrier. Like, we can't change everything, but where is your sphere of impact? What are those leverage points that you can do something about within your role? Whether that's traditionally, within family support and prevention, or outside of that as a business person, as a politician, all those types of things. And so I think if you can get folks to just stop and hear about it and discuss it and digest it, then they come to that place. So I think the theory of change helps overcome the fact that it is such a comprehensive idea. And then the other two are just sort of like, we've all been there, right? We've described it lots of times. We've sat in meetings, we've been in work groups, we may have spent years on something, and at the end of it, it's like, what's different? And so a lot of folks might see this as, oh, great, just another plan, just another strategic plan, just another idea. But I think those leverage points that are built into it really help folks see the practical nature of it. Again, if you can get them to talk about it, think about it, ruminate on it, then it becomes a really practical guide for what actions you can take, again, within the areas that you can impact. And it may also help folks recognize they can impact other areas that they haven't traditionally thought about as sort of their responsibility in this bigger ecosystem. And then the last is, unfortunately, there's competition in the field. There's competition for funding a lot of times. I mean, just the way that grants are written and all kinds of things are done, it fosters some of that competition. Some folks don't want to participate because they didn't come up with the idea. Their name's not on it. And again, I think the theory of change helps alleviate those things, particularly as we point to that North Star and we point to those aspirational goals. It would take a pretty sad individual not to agree with those things. I don't care what their background is, what their religion is, their political, ideologies are. I think those are things that most folks can agree on. And if we focus on that, then it becomes a little easier, I think, for folks to get on the bandwagon and not be like, oh, this is PCA trying to show off. But this is really, it's a job for all of us. And that's the other piece of it. We can't do this ourselves because there are so many pieces of it. There's no way any one agency, any one system can manage everything that we need to do to truly create that environment where children and families are prospering and growing and are healthy. So, I think the goal or the theory of change addresses a lot of those, barriers in and of itself. The main thing is we've got to get people engaged with it to start with. And so we need to present it to more folks. We need to help folks, get in with it. As far as me and the healthy family sort of piece of it, I will be doing some training and conversations along the lines of what Nate's been talking about with the Healthy Families programs that I work on to help them, one, understand it and see it, but then really to delve in and see how they can use it at their local program level and with families, because I think there's a huge amount of benefit that we can derive by really taking this all the way to the level of individual families and helping families understand it and move on from there as well, so that they see themselves, because they are part of that prevention ecosystem as well. So I think there's a lot of things that we can do along that way. And so that's sort of going to be some of my focus on it, is really working with individual programs. And I hope to present it to the state team for MIECHV, so that as we are developing RFAs and moving forward with collaborative relationships, it sort of informs that work, as well as the home visiting collaborative that we have here in North Carolina, presenting it to, I'm going to volunteer Sharon to co-present this with me at that group. So I think we've got a lot of opportunities to address some of those potentials here in North Carolina with it.
That's fantastic, Mark. Thank you so much. And we'll love to hear how that, I love the idea about including the language and in the RFAs. Love that. And anything we can do here to help, let us know. So we have about 3 minutes left, and I'm gonna, I don't think there's any questions in the chat. I haven't seen any come in, but what I'd like to do is that just as we wrap up, see if there's anyone from the panel who would like to share or reflect on anything either that you're thinking about or that you heard. Not all of you have to do that, but just want to see if anyone would like to share or reflect before we end here.
I just had one more thought that I think is driving me to really listen with regards to the implementation. You know, there's a lot of people in this field in doing this prevention work in the early childhood sector who have been doing this work for a long time. It's their life's work. And they've seen a lot of theories come and go. They've seen a lot of surveys come and go, and promises either through strategic planning at the state level, maybe some federal promises of legislation come and go, right? And so the thing that I think is keeping me humble and listening on this is thinking, why is this different, right? Like looking at those people that have said, I remember 2012 when we had something like this, then again 2016, 2017, 2018. Why is this different? And I think that just the thought process alone is really keeping our ears to the field itself to say, it is, I'm coming at this with a lot of energy, but then understanding that constant, where are we at? Where are you at? Where are they at? And what have they been through with regards to this type of collective work? And so, and this is not a word of caution. I don't think I'm asking that question with fear. I think I'm asking that because it is inherently different. And the way we enunciate it and approach it is, I think, gonna kind of, that is, that we have to have that constant conversation going, and to be able to represent it is going to be part of its implementation success. So I just wanted to add that, Jenny.
I love that, Nathan. And I think we really built that intentionality when we created the theory of change. It was super important to us to get that feedback and that insight and constantly sort of check, pressure check the where folks were coming at. And we did it with families and caregivers, and we did it with staff and partners and Healthy Family Sites, Prevent Child Abuse Network chapters as well. So I know we're here at the end, and so I'm going to just close us out by saying thank you, big thank you to our panelists. There was so much great information and insight and words of wisdom that you shared today. I always learn a lot when I'm in your space. And I really appreciate all that you do for kids and families in your state, but also for the national, and all the leadership you provide at the national level. And so thank you so much. I also want to just say thank you to all of you who have joined us today. This was the first session in our 2024 Zooming Out speaker series. So stay tuned. There will be more to come. And we will certainly share those with you as we will announce those as we identify those. Also, if you have any questions or want to talk more about the theory of change, we would love to have those conversations with you. So please do reach out to me or Kirsten or anyone on the PCA team, and we can certainly have those conversations. Again, all of the information is on our website. Feel free to jump on there and reach out if you need anything. Everybody have a great, awesome rest of your Thursday. Thank you again, and we look forward to seeing you all soon.
Thanks.